A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better, and I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think she has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, you know, pulled up the neck and, you know, so that this is really clean in here. And I had, with the weight loss, I had a lot of hanging skin, and he, you know, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. You know, nobody's pressuring you. So I just felt comfortable with him.